Perspective of Electronic Health Records. Research has shown that less than 20% of physicians and clinicians have adopted electronic health records. While most will note that the return of investment is a major reason for this small number of users, the overall advantage of an EHR cannot be ignored. This presentation will identify such advantages of why an EHR should be considered to increase the quality of health care that is provided to patients. What makes it good? According to the article, Unintended Consequences of Information Technology Healthcare, patient care information systems are defined as one of the core building blocks that help provide for a safer environment within healthcare. With the aid of electronic patient records and access to current medical knowledge, studies have shown there has been a reduction in faulty decision-making processes by clinicians and the like. Ash et al. Also note that computerized provider order entry systems have reduced errors by eliminating ineligible orders, improving communications, improving the tracking of orders, checking for inappropriate orders, and reminding professionals of actions to be undertaken. According to John Sidroth, there is a case for EHRs. When evaluating worker productive gains, an analysis showed that documentation among physicians was increased by 17%, and CPOE provided an increase of 98%. If EHRs consistently reduce labor costs, the lower staffing ratio should enable insurers to reduce their fee schedules among EHR-enabled providers. From a billing optimization perspective, there is the fact that EHRs can auto-populate records to justify a greater intensity of service. This can lead to a more efficient way to capture changes within a patient record and therefore result in fewer billing errors. When looking at avoiding medical mistakes, a decision support mechanism has been identified as the source that can reduce errors of admission and commission at the point of care as a critical safety advantage. Such examples include alerts about vaccination status among children cared for in the emergency department, health maintenance and counseling in a pediatric practice, hypertension identification and control, guideline promotion, and alerts about cost and redundancy. Storage of other encounter data, such as past medical facts, is a benefit of EHRs. EHRs and CPOEs can reduce the mistakes that are made in prescribing medication. They can also make medications less readily available to physicians and clinicians. While there is no direct evidence that EHRs will reduce malpractice suits, it can be inferred that with fewer medication errors and better documentation on informed consents, the number of malpractice cases could be reduced. In conclusion, William Steed states it best. Healthcare IT improves quality and safety by supplying information when and where it is needed to help people make better decisions, by eliminating communication and process errors, and by analyzing information about the patient in combination with biomedical knowledge to make patient-specific recommendations. It improves efficiency by connecting information access across healthcare transitions and eliminating steps and rework. It is with great hope that the 20% user population of EHRs will continue to grow. While research studies are still in their infancy, it is obvious that there are many advantages to both the physicians, clinicians, and the patient that cannot be overlooked and should be taken into consideration when deciding to implement an EHR.